action when it comes to sex education in and out of the school system. We're going to start by talking about Jane and Dick. Jane and Dick are dating. She's 14, he's 16. While he's dated a little bit before, this is Jane's first real taste at dating. They've decided after 8 months of dating that they're going to take their relationship onto the next level. They're going to have sex. They're in love. They think this is the next logical step. Everything goes fine. They stay together. Everything's working out. All of a sudden, Jane gets the flu, so her mom takes her to the doctor. Turns out, Jane's not only pregnant, but she has herpes. Morally, ethically, and financially, this affects each and every one of us. After researching this topic, I found that the statistics are just staggering. Today, we're going to talk about teenage pregnancy, STDs, and the dangers of ignorance. Teens fall in love every day. Most schools teach an abstinence-only program. This really got started during the Bush administration, and it doesn't seem to be working. Teen pregnancy and STDs among teens have increased. Pregnancy, for the first time in 15 years, has started back on an increase. Mississippi is leading right now. They just overtook Texas, who held the reign for several years. The cause of this is simple. Teens are having unprotected sex. Unprotected sex can lead to pregnancy and STDs. The authors in Z News report that the recent decline in teen contraceptive use since 2003 could be the result of a faltering HIV prevention program and efforts among youth of more than a decade of abstinence only until marriage, sex education. This does not, they don't talk about contraception, and when they do talk about it, they only talk about its ineffectiveness. These are not the facts. We're all affected by this. Certainly these teenage boys and girls that are getting STDs and having babies, their parents are affected by it, all of society. Each year when we pay our taxes, a good bit of that goes towards programs to help out these kids. The Center for Disease Control and Prevention, or CDC as we mostly know it by, states that preventing teen childbearing could save the United States about $9 billion per year. If we don't take action and start educating these children, more of the same vicious cycle is going to continue. Kids are going to keep having babies. People with STDs are going to keep passing them around. Statistics also show that when a teen mother has a baby, if it's a daughter, they are more likely to have another teen pregnancy. These are all things that we don't want to have happen to ourselves or to our children. We can make a huge difference in these staggering statistics just by providing straightforward, honest facts to these kids in school in a purely biological format. This should not include religion or guilt. This is biological facts. Unfortunately, it seems like this should be taught at home. However, it's not, so we must take action. We must take control. Sex ed in schools should cover STDs. And when I say cover STDs, I don't mean saying the scary word of gonorrhea. I mean pictures of it, pictures of herpes in the genital areas. We need to provide prevention steps for these children, how to avoid getting STDs or becoming pregnant. How about what to do if your condom broke, now you're pregnant or you're sick? What is the next step? How do you keep yourself as healthy as possible? We also need to provide options for pregnancies. It doesn't really matter where you stand on the situation. The fact is, in this country, some of these things are still legal, and these people need to know about it. We also need to provide locations available for obtaining prevention. People should be able to get condoms. By not providing them, all we're doing is allowing a forum for more STDs and more pregnancies to occur. DailyNewsHealth.com reports among the girls, there were 800 girls interviewed, and among those who admitted having sex, the rate was even more disturbing. 40% of the ones that admitted having sex have had or have an STD. That's staggering. The majority of teachers, this is from Guttmacher.com, the majority of teachers believe that topics such as birth control methods and how to obtain them, the correct way to use a condom, sexual orientation, and factual and ethical information about abortion should also be taught by the end of the 12th grade. These topics are currently being taught less often and later than teachers think they should be. We must provide actual facts to these kids. By providing prevention, by providing facts, we'll keep them from getting sick or pregnant. This should be done in school. It's absolutely affordable. This is a lecture. That's all it takes. and we do need to have parents involved. Clearly, providing information and contraception to kids while encouraging abstinence is the best way to prevent STDs in teenage pregnancy. We must take action, and we must start today. Each of us should go home and talk to someone, a parent, a child, a neighbor, whatever, about the importance of protecting yourself in all aspects. A lack of communication, which is what we're having with this abstinence only begets more ignorance. So let's try today to end, or at least reduce, the instances of kids becoming sick or pregnant. Teens are having sex with or without facts. We must start talking about it and providing them actual facts. Knowledge is power. Give your child the knowledge that he or she needs to make the smart decisions about sex. If you choose not to, your kid may be the next to say, "I'm 15, HIV positive, and pregnant." Wouldn't you rather them just use a condom?
Good stuff. That was even better than the last one.